The first case of HIV infection in Kenya was diagnosed in 1984 and 15 years later in 1999. The then President Daniel Moi declared the disease a national disaster, hence opening the floodgates for donor funding in aid of several programs initiated to fight the scourge. Between 2009 and 2013, for example, donor funding accounted for over 70% of HIV expenditure. The government contributed 17% of funding, with private and household spending making up the remaining 13%. Even as the cost of HIV response in the country was projected to increase by 114% between 2010 and 2020, the big question is, what has this huge spending achieved so far? Whereas HIV prevalence rates have dropped from a high of over 30% to just about 6% nationally, this has not been the case for some 9 counties that bear the greatest burden of HIV in the country. These are Homa Bay with HIV prevalence of 25.7%, followed by Siaya 23.7%, Kisumu 19.3%, Migori 14.7%, Kisii 8%, Turkana 7.6%, Mombasa 7.4%, and Nairobi at 6.8%. With such scenarios, questions focus on whether such funds are being used prudently.
The vast majority and the vast amount of that cash goes towards providing clinical services, which is ensuring that patients have got access to medicines and ARVs. Patients have got access to other services related to HIV. HIV is not just about taking ARVs. HIV affects the family in many ways. Some of these patients are breadwinners themselves. So there are support services which are allied to HIV, which involves community health workers, which actually involves pharmacists, involves clinical officers. So those services all derive resources from one pool. That is why it looks as though that a lot of money is actually being spent.
Dr. Makobewa says that money meant for fighting HIV/AIDS may have been misappropriated is partly fueled by the fact that in most situations, stakeholders' conferences involving practitioners in the sector were done in posh hotels. He, however, agrees that indeed there are isolated cases where money was misappropriated.
I think corruption exists everywhere, but I think in terms of HIV/AIDS, of course, there might be organizations who might not have actually used their funds properly. Some of this cash, when it comes in, the funder has given you 12 months or 24 months to finish that money before you can actually apply for more. That may or may not have led to, 1 or 2 organizations actually misappropriating funds.
Financial fraud is something that is happening, particularly in a response like HIV, where you have to respond in a very fluid environment because you don't have a perfect cure for it. So you're testing, you're trying to get communities involved. You need to monitor each and everything that everyone has done. You don't have capacities to do that. So the probability of getting a few individuals who decide to become fraudulent can actually lead to that misappropriation. Another occurrence is where we have fake NGOs, majority of which are pretending to fight for the rights of the girl child and help in eradicating HIV/AIDS. Luminary Foundation on Girl Child Education and Pacesetters Network are among the NGOs that lures their victims with lucrative deals which they are promised to once they part with some amount of money. Mohammed Odhiambo, 23, is one of the youths who has been duped to sending money so as to be considered for an interview by the fake NGO within Migori town. Odhiambo, having completed his college and was now looking for a job, bowed to the pressure from the organization and sent them 3,000 Kenyan shillings.
When we went for the interviews, we had to depart with 3,000 for us to get that job. 3,000 Kenyan shillings for people who have just left college like us, for us to get a job. So we had to do all we can to give that money because we wanted the job.
20,000 shillings when they said they'll offer me a job. But 2 days after, when I went to their offices waiting for that job to see if they see the progress of what they would offer me, I found that they don't exist.
However, one James Acheng believes that the NGOs are taking advantage because of the weak government policy on regulating such organizations.
I think the government needs to crack the whip and crack it seriously so that we wananchi we really feel the impact of this.
The assertion is corroborated by past arrests and prosecution of senior directors of the National AIDS Control Council, both at the national and grassroots levels. Amongst the highest profile cases include the arrest and conviction of Dr. Margaret Gashara, the then director of the organization, who was found culpable for receiving 26 million shillings in illegally hiked salaries. In another incident still involving a council officer, a random audit of the then Northeastern Provincial AIDS Control Office records found that the area Provincial AIDS Control Officer Ali Ahmed Adan had received about $26,000 after registering 4 organizations that he used as a conduit to receive the cash from his office. Key concerns also emerge over the efficacy of grassroots organizations in implementation of HIV-related projects.
Before a project starts, let us get the Kenyan people to understand the value of that project and get the people also within that community to be vigilant, to ask questions around how about our resources being used. I'm not seeing value for money. So that watchdog element, if it happens in a community, there's always order that comes with it.
Efforts are, however, being made to curb the pilferage of funds associated with HIV and AIDS sector. The government has also instituted measures that require funding organizations to spell out areas in which they want to implement projects and channel them through the right mechanisms to avoid duplication of roles, as witnessed in Kisumu, where more than 100 NGOs and CBOs are addressing the plight of orphans and vulnerable children and widows, yet the HIV prevalence rates remain high.
Sell the 10, you use 5 to buy sex. You do not have to buy sex with cash. You can exchange it with fish as well. So they've got access to currency, whether it's in terms of fish or in terms of cash, to actually buy sex.
There are also demands to have the government fund HIV-related activities, a situation that many feel will see the government get more involved to understand what is being done in the sector. Reporting for Channel 1, I'm Rose Wasike.